Douglas's face. So just so you know too, you never know how many people will be at a session, okay? And so even if it's just us, we will run the session as if there's a population, because this is going to be recorded and it's going to be available for viewing, okay? And I've already had people say that, email and say, I have a class at this time or something like this, but we're going to look at the recording. All right. Hi, Dr. Watson.
Hello, Professor Payne. How are you?
Pretty good.
It's good to see everyone. Is that Dr. Smith down there?
Hello, Veronica. How you doing, buddy?
Hey. You know you can't leave your camera off when you come into family.
I know. I'm here.
His name is John. He grew up all over the world. His dad was Air Force, and he said that they moved every 2 years.
He has lived in Belize for the last 10 years.
I'm kind of big cities, and I tell him like small world. It's just a place.
If someone wants to make me co-host, I can help
Enjoy life.
with things.
I've got a lot of nice people.
Okay. Okay, let's see. How to co-host? I wonder more. There we go. Oh, How do I make you a co-host?
Chris, do you need to do that?
Who wants to be who's looking being co-host?
Veronica?
Let's
Dr.
see.
Watson?
Okay.
You should be good.
Thank you.
Mm-hmm.
Thank you. Okay, we'll give it one more minute and then I'll begin. Okay, Micaela and Taylor? Okay.
So good to put names and faces together after seeing your abstracts. I've been playing with your stuff for a while, so. I just dropped the link for the Padlet board into the chat.
Thank you. Okay, so we'll go ahead and get started. Well, thank you and welcome to the Douglas Research and Debate Days. This is I believe, our second panel of the day. And so thank you again for taking the time to come and join us. I think I was able to attend the first panel of the day that happened at 12 o'clock and left there feeling really stimulated. The content was rich and deep, and I think that they really set the stage for another wonderful panel that that we're going to have again this evening. So just to offer a few words of encouragement and affirmation, and this is in light of the sensitive topics that students are going to be presenting on, and also the fact that, you know, there's a lot happening in the world with the Chauvin verdict, and also the latest cases of unarmed Black people being assaulted or killed by police. One of the things that we're trying to do is to really create a positive intellectual and emotional psychological space during this event. And so I just encourage you to take advantage of listening, but then also participating. And also, I believe Veronica has put in the chat the place where you're able to go and give feedback just about what you're hearing, your impressions, any insights. All of those things are welcomed on that page so that we can have it as a record and also as an archive. Okay, so I want to go to Micaela Ricco. She is going to be our first participant for the day. Micaela, would you like to set up your PowerPoint?
Yeah, I can.
Okay. And as you're doing this, I'm just going to say a little bit about you. So Micaela Ricco, she is from California University of Pennsylvania. And she is going to be speaking to us today about social justice and health, African Americans, and sickle cell disease.
All right. Good afternoon, everyone. I would like to thank you all for being here today. And I want to thank everyone for the opportunity. Today I will be sharing my research on social justice and how the effects of sickle cell disease has on the African American community. There are many different definitions of social justice, but they all have the same meaning of equal rights, equal opportunity, and equal treatment. Social justice is especially really important within the healthcare field because without it, it cannot ensure that everyone is receiving high quality care. And it's really important, especially today during the time we're in, that everyone is receiving equal opportunity within the healthcare system. We want everyone to be able to maintain the highest level of health and wellness. For a little more background on social justice within healthcare, I'll give you guys an example. Social justice in healthcare is training workers to advocate for patients, making sure that staff is properly trained in all types of people. Social justice is really important within the African American community because they are at a higher risk for some diseases that they can't control. One example of a disease is sickle cell disease. The African American community is the most common ethnic group that is affected by sickle cell disease. Sickle cell disease occurs in about 1 out of 365 African American births, and 1 in 13, or approximately 3.8 million babies, are born with sickle cell trait. The disease is so common because of an abnormal hemoglobin gene that is prevalent within the community. Sickle cell disease is a disease of the red blood cells. So normal red blood cells are round and they move through small blood vessels to carry oxygen to all parts of the body. In someone with sickle cell disease, the red blood cells become hard and sticky and look like C-shaped like farm tools called a sickle. So therefore they got the name sickle cell disease. There are many signs that can lead you to believe that you do have sickle cell disease. When the body isn't provided with enough red blood cells, the body can't get enough oxygen, which causes fatigue. You can also experience episodes of pain throughout the body, but especially pain within your chest and abdominal region. This pain is caused when sickle cell red blood cells block flow through tiny blood vessels. With this being such a prevalent issue among the community, after the video that I'm going to show, I want to tell everyone a little bit about an organization that does help with sickle cell disease. But for right now, I'm going to show you guys a video, if my mouse will work, on sickle cell.
Grammarly does more than catch errors. With Grammarly, you can find really good, no, perfect words.
Sickle cell disease is a group of inherited blood disorders in which the body produces abnormally shaped red blood cells that look like crescent moons or sickles. Sickle cells have a shorter than normal lifespan. Their premature destruction results in shortage of red cells, known as anemia. Signs of anemia include shortness of breath, fatigue, and delayed growth in children. Unlike normal red cells, which are pliant, sickle cells are rigid and also sticky. They may clump together and stick to the walls of blood vessels, causing obstruction in small vessels and subsequent reduced oxygen supply to various organs. This happens repeatedly and manifests as periodic episodes of pain called crises, which can last hours to days and may result in organ damage, especially in the eyes, lungs, kidneys, bones, and brain. The spleen has to handle large numbers of dead red cells and becomes enlarged and fibrous. Its immune function declines, making the body more vulnerable to infections. In an attempt to compensate for blood cell loss, the bone marrow tries to produce more cells and grows larger, causing bones to weaken. Other signs include jaundice, a result of rapid destruction of heme. Hemoglobin is the major component of red blood cells and is responsible for oxygen transport. The adult hemoglobin, or hemoglobin A, is composed of 4 protein chains.
Micaela,
Alpha.
I cannot see the video, just so you know.
Oh, you guys can't see the video?
I can hear it, but I cannot see it.
Hmm.
The beta subunit.
Hold on. Sorry, guys.
That's all right. You might need to There
Can
you
you
go.
see it?
Yes.
Do you guys want me to start it from where it
Yes.
left off?
Yes.
Okay.
Go ahead. You have time.
Oh, do you want me to start from the beginning or where I left off?
I think from the beginning.
Okay, I'm really sorry about that.
That's all right. Yeah, it's only 2 minutes in. So from the beginning, and then we can see.
Okay, I'm sorry.
Sickle cell disease is a group of inherited blood disorders in which the body produces abnormally shaped red blood cells that look like crescent moons or sickles. Sickle cells have a shorter than normal lifespan. Their premature destruction results in shortage of red cells, known as anemia. Signs of anemia include shortness of breath, fatigue, and delayed growth in children. Unlike normal red cells, which are pliant, sickle cells are rigid and also sticky. They may clump together and stick to the walls of blood vessels, causing obstruction in small vessels and subsequent reduced oxygen supply to various organs. This happens repeatedly and manifests as periodic episodes of pain called crises, which can last hours to days and may result in organ damage, especially in the eyes, lungs, kidneys, bones, and brain. The spleen has to handle large numbers of dead red cells and becomes enlarged and fibrous. Its immune function declines, making the body more vulnerable to infections. In an attempt to compensate for blood cell loss, the bone marrow tries to produce more cells and grows larger, causing bones to weaken. Other signs include jaundice, a result of rapid destruction of heme. Hemoglobin is the major component of red blood cells and is responsible for oxygen transport. The adult hemoglobin, or hemoglobin A, is composed of 4 protein chains, 2 alpha and 2 beta. The beta subunit is encoded by the HBB gene. Several mutations in HBB gene are responsible for the disease. Each individual has 2 copies of HBB gene. The disease develops when both copies are mutated, producing no normal beta globin. The 2 copies may be mutated differently, producing 2 different forms of abnormal beta subunits in the same person. Various combinations of these mutations produce different forms of sickle cell disease, but the most common and also most severe, called sickle cell anemia, is caused by 2 copies of the same mutation, producing the mutated hemoglobin S. Each copy comes from a parent. The 2 parents each carry 1 copy of the mutated gene, but they typically do not show any symptoms. This pattern of inheritance is called autosomal recessive. Hemoglobin S has the tendency to form polymers under low oxygen conditions. This process is called sickling or gelation for the gel-like consistency of the resulting polymer. As the polymer filaments grow, they eventually involve the cell membrane and distort the cell into the characteristic crescent shape. Apart from oxygen tension, the presence of other hemoglobins also seems to affect the sickling process. Normal adult hemoglobin inhibits sickling, and this explains why heterozygous parents who produce both mutated hemoglobin S and normal hemoglobin A do not usually develop the disease. Fetal hemoglobin F, which has 2 gamma chains in place of 2 beta chains, also suppresses sickling. Infants born with the condition seem to benefit from high levels of fetal hemoglobin in the first few months of life. They do not develop symptoms until the age of 6 months or so, when fetal hemoglobin levels drop. Bone marrow transplantation is currently the only known cure for sickle cell disease. It involves replacing the diseased stem cells in the bone marrow with healthy cells from an eligible donor, usually a relative. The procedure, however, is complex, and finding a suitable donor can be difficult. In most cases, treatments aim to avoid crises, relieve symptoms, and prevent complications. These include prophylactic antibiotics, vaccinations to prevent infections, pain medication to relieve pain, drugs that promote formation of fetal hemoglobin to suppress sickling, periodic blood transfusions to reduce anemia and prevent crises, and early detection and treatment for complications when these occur.
Okay. Can you guys see my PowerPoint now? Okay. Okay, so the organization that I would like to briefly discuss is the Sickle Cell Disease Association of America. And the role of the organization is providing leadership on a national level to create awareness of the negative impacts sickle cell has on the health, the economic, the social, and education well-being of the individual. They prepare and distribute educational materials such as pamphlets and anything that would be educational to someone who is in need of it. We also organize and participate in educational conferences. The organization's mission statement is to advocate for people affected by sickle cell conditions and empower community-based organizations to maximize the quality of life and raise public consciousness while advancing the research for a universal cure. The SCDAA, they also are partnered with the American Red Cross in efforts to donate blood to patients. Their main initiative with the partnership targets the African American community and highlights the need for a stable blood supply of a blood donor of African descent. And the SCDAA as a whole is very passionate about having social justice within just everyone. And here's some contact information for the Sickle Cell Disease Organization. And just some ways to get involved in social justice efforts are examine your beliefs and your habits, educate yourself about social justice issues, volunteer, and donating to any organization also really helps with that. And these are just my references for everything I used.
Professor Payne, you are muted.
Oh my gosh, sorry. Okay, let's try that again. Thank you. Thank you very much for your presentation. And I do have one question for you that I was thinking about as I was watching the video and thinking about COVID. Can you talk a little bit about maybe how COVID is impacting people who have sickle cell?
People with sickle cell are at a higher risk of getting COVID and potentially being worsely affected by it because they do already have a weak immune system. Their red blood cells aren't able to fight things off as well. And so they are at a really high risk of getting it and being hospitalized with it.
Wow. Does anyone have any other questions for her?
I do. Micaela, thank you so much for the presentation. That was
You're
fun.
welcome.
I'm really interested, I mean, because it felt to me like you had two different pieces going. So on the one hand, you wanted to sort of inform us about what sickle cell is and its symptoms and how it expresses in the body. And then you seem to have this other piece of your conversation going that was really about trying to connect it to social justice. And for me, those two in your presentation remained kind of distinct. So can you help us understand a little bit more about, for instance, the one organization that you shared with us? How is that, or is that perhaps, is a better question, an attempt to meet a social justice concern for people who have sickle cell? Is it, I guess I'm just trying to understand a little bit more how those two things connected for you.
Oh, yeah. So with sickle cell disease, since it is so prevalent within the African American community, we do see social justice issues going on still today with how people are being treated. So with the SCDAA, they do like to advocate for people who are not as like they are at a really high risk for the sickle cell. So they do want to make sure everyone is getting the social justice and the right treatment that they should be no matter what.
So for you, perhaps as the researcher, is the issue around social justice that African American people don't have generally as good of healthcare that would allow this to be something they got diagnosed? Is it that the research isn't there to help bring about good treatments? Is it something else? So what is the issue around sickle cell disease that you think is most pressing?
There isn't a lot of hard-hitting like research and treatments to cure it and just better things, because as you saw in the video, they only have the transplant that will help with it. They do have things to slow it down, but there's no definite cure and easier ways for them to be able to cure it. So there should be more research, and they should be pushing for better care for these types of people.
Okay, thank you.
You're welcome.
Any other questions? I have one more. I wanted to ask you, how do you see this informing your future in terms of your future career path and goals?
So in the future, I do want to become a physician's assistant. So I think knowing about different types of diseases already and being able to see the social justice issues that are happening and being able to have ways to fix them, it'll just help me in my future to be able to open my eyes and be open to any type of research that is put on me, any type of disease that there is. So I do think this is very helpful for my career.
Mm-hmm. Well, thank you very much for, I thank you for your presentation, but also taking the time to research this particular topic, because I think it is important as our communities, because even if you're in a rural community, like to think that it's going to be kind of mono in terms of racial groups. I mean, rural communities are becoming more and more and more diverse as we speak. And so it's important to have people that are, if they're in a rural environment or if they're in an urban environment, who are, and I say students, who are really diving in deep with this kind of research early on in their path, in terms of their career path and as students. So thank you for that.
You're welcome.
Okay, so as we change over to Taylor, can you now begin to get your presentation together? I just want to turn everybody's attention to the chat. And what I placed in the chat are the social media handles for the Frederick Douglass Institute that you can visit. And oh, you might have to bring your chat back up. Okay, yeah, there it is. Okay. The social media things that you can visit. So they have a Twitter handle, Instagram, as well as a Facebook page. And I also want to remind you that these events are going to be, you can review them. And Veronica, please tell me, where are they going to be located? I believe it's we have a YouTube account.
That's exactly right. This first time we have to upload them, but after this they'll be live streamed, and all of the recordings of the sessions will be available on YouTube, as well as the Frederick Douglass Institute Collaborative webpage. So if some of your friends aren't able to make it today, you can point them here and say, you can still see me, just go look at this video.
I think that is such a wonderful feature of this conference. And I also think it's a way that we've been kind of shifting and adapting. And so shifting and adapting through this pandemic to continue to offer programs that are relevant, you know, that are important, and where people can have access to them. So so thank you for that. And then the other thing I wanted to mention too is that after this, we have this another special event, and that is the roundtable, What's Next for Hip Hop, Artistically and Academically. And so that will be at 6 o'clock, and the link is located in the program. And I think maybe I'll look for it, and I can also put that in the chat at the end also. Okay, so now turning our attention to Taylor, and she's going to talk to us today about cardiovascular disease. Take it away.
So thank you all for coming today and listening. I'm really excited. So as she said, I am doing cardiovascular disease in the African American population. So cardiovascular disease is a group of diseases that involves the heart or blood vessels. So the most common conditions that I have on here, there are many different types, but I chose, I think, the top 4. So it's a myocardial infarction, a heart failure, arrhythmia, and heart valve complications. So a myocardial infarction, that's just a fancy word for a heart attack. This occurs when blood flow to a part of the heart is blocked by a blood clot. Heart failure occurs when the heart is not pumping blood as well as it should be. An arrhythmia, this refers to an abnormal heart rhythm, so whether that be fast or slow. And then heart valve complications, this occurs when the valves in the heart do not open enough to allow the blood flow through as it should, and this is called stenosis. So heart disease is actually the #1 killer for all Americans, and it's even higher for the African American population. Some risk factors that I have on here: hypertension, obesity, and diabetes. So hypertension in African Americans is also the highest in the world and develops earlier in life. Obesity is also a risk factor. 69% of men and 82% of women are overweight or obese. And then diabetes is also a major risk factor as well, and African Americans are more likely to have this disease than non-Hispanic whites. There are some treatment options for cardiovascular disease. The first one is lifestyle changes. So you can lower your risk of heart disease by eating a low-fat or low-sodium diet, getting at least 30 minutes of exercise a day, quitting smoking, and limiting your alcohol intake. Then the next one I have on here are medications. So if lifestyle changes aren't enough, your doctor may prescribe medications to control your heart disease. The type of medication will depend on the type of heart disease that you have. And then lastly, I have on here surgery. If medications aren't enough, it's possible your doctor will recommend specific procedures or surgeries, and the type of surgery you have will depend on the heart disease and the extent of damage to your heart. So to diagnose cardiovascular disease, your doctor will first do a physical exam, and then after that exam, he or she will ask you your family history. And then after those 2 things have been done, your doctor may order some tests, and these tests can include blood tests, chest x-rays, an electrocardiogram, which is just a quick and painless test that records the electrical signals in your heart. It can spot abnormal heart rhythms as well. And then Holter monitoring, it's basically the same thing as an electrocardiogram. It's a portable device though, and you wear this consistently for 24 to 48 or 72 hours. And this records your heart rhythm as well. And then I have on here an echocardiogram. This produces sound waves and produces images of your heart structure. And then lastly, a stress test. This involves raising your heart rate with exercise. So this can determine how your heart responds to this exercise and stress. So it's important to note all of these special tests that healthcare professionals use to help diagnose patients who might have or show early signs of heart disease. Within the African American population, these services are not as easily available as for everyone else. So I have on here some disparities in health that we see. Socioeconomic status is a big one. Due to structural barriers, African Americans are more likely to be poor than white Americans and are less likely to have a full-time job. The second is location. If you're not in an area that has access to a nearby hospital or grocery stores when needing medications or nutritious food, and that's a big one as well. Number 3, food insecurity. This just means and occurs when a household lacks access to adequate nutritious food. This happens due to lack of financial means to purchase by living in impoverished areas. And lastly, neighborhood safety. This can include a lack of clean water, pollution, or exposure to chemicals such as lead paint. So the Association of Black Cardiologists is an organization dedicated to spread awareness for this population in cardiovascular disease. So I'm just going to talk a little bit about that. Here is their mission statement. So they promote the prevention and treatment of cardiovascular disease, including stroke and other minorities, to achieve health equality for all through the elimination of disparities. So, sorry. So some background information: they are established to bring awareness to cardiovascular disease for African Americans. They were founded in 1974 by Dr. Richard Allen Williams. Their goals: they lower the rate of cardiovascular disease and strokes in minority populations. They try to reduce the disparity in cardiovascular disease by 20%, and they make healthcare affordable for all and available to all. So why was it established? The Association of Black Cardiologists was first established as a nonprofit organization. They allow health professionals who are dedicated to eliminating the disparities related to cardiovascular disease spread awareness. And regardless of their race, ethnicity, or gender, all people should benefit equally from healthcare. So I just have a quick video really quick to dive deeper into this organization to get a better understanding. Can you all see the video?
More than 44 years ago, I had my first visit with a cardiologist. I was 12 years old at recess in school, running around, and I fainted. And when they took me to the hospital, my heart rate was above 130 beats.
I had a wake-up call in 1988 in which I had a single vessel coronary bypass. After that procedure was done, my doctor said to me, "Ed, I'd like you to consider a low cholesterol, low sodium diet for the rest of your life."
The disparities of cardiovascular disease in the African American and the Latino community is really severe.
Heart disease and stroke is the #1 cause of death. Unfortunately, African Americans have a 33% higher rate of heart disease death.
When I see the everyday people, when I tell them where I work, the Association of Black Cardiologists, I want them to know that we are a very diverse group. Our focus is on prevention and reduction of heart disease, and there's a role for them to play within the organization.
The Association of Black Cardiologists began over 40 years ago by a group of 17 visionaries who recognized that there still remained an inequity in terms of survival outcomes of cardiovascular disease among African Americans, and they decided that they were going to do whatever it takes in terms of education to the communities, to providers, to institutions. We see really high incidences of heart attack, stroke, complications from diabetes. And so it really is very important for us to get this message out, and specifically how we can provide effective strategies to help reduce cardiovascular disease on these communities. I think as healthcare providers, we have to get into the habit of encouraging our patients to become partners in their care. The Spirit of the Heart program is the Association of Black Cardiologists' signature program. It's their program that they really use to engage the community. We have a Community Leaders Forum is an opportunity to engage key community leaders within the respective community. The second is a health risk assessment activity and a patient education activity. Additionally, we have our 7 Steps to a Healthy Heart and other patient education materials.
It is by our various programs that we've been able to reach over 1 million people over the last approximately 40 years. The American Society of Hypertension has partnered with ABC in places like Denny Moe's Barbershop.
We bring out screening mobiles that people screen for prostate, colon cancer, diabetes, cholesterol, hypertension, bringing the hospital to the barbershop.
A lot of guys don't like going to the doctor, so sometimes you can catch stuff before it hits.
I did not have a heart attack. I just had a single vessel coronary bypass. And I said to myself, yeah, I had responsibilities as it relates to being the CEO and founder of Essence, that I had a responsibility to my family and I had a responsibility to my employees. And that changed the focus of my life with regard to how I wanted to deal with the issues of my heart.
I think the importance of this is to make sure that the people in our community is healthy. Know your status. You only have one body.
I thank Association of Black Cardiologists for having a platform where they come into the communities and they educate the masses about what happens to people of color with heart disease. But the more that you talk about it, the more that you're educated, the more you're apt to see change happen. The key is actually paying it forward, because that's what I believe that they do. They're paying it forward.
Can you see the PowerPoint? Okay. Oh, whoops. Okay, so they talked about this a little bit in the video, but the Spirit of the Heart is just a community outreach program intended for this population and other minorities of all ages. They educate how heart disease is preventable and how to increase your longevity. They have a lot of webinars, but it's also implemented in some regions, some including Georgia, Texas, and others that I have listed there. So during this synopsium, they have multiple activities, and I have them listed here, but some of them include cooking alternatives, COVID-19 and cardiovascular health, telehealth tips, and taking care of your cardiovascular health. I also have this slide on here. I just have a link where you could donate if you need other information. There's also other ways for their members and others not in the organization to give monetary donations, and that's through their website. There's also a lot of health profession job opportunities, so I have those listed here as well. So cardiologists, professors of medicine, nurses, nurse practitioners, patient care specialists, and so that's another way to get involved as well. And then here are some scholarship opportunities. So if you're looking to go into cardiology or any type of medicine, they also have these readily available for you as well. And then here's their contact information. And yeah, so thank you all for listening. And I also wanted to thank Dr. Walker for helping me throughout this process and providing me this opportunity to present.
All right, yay. Okay, so any questions for Taylor? I have one for you that's like right on the tip of my tongue. I'm sorry.
The moderator's prerogative to go first with the questions, right?
And so there was I was going to ask this question about if you felt that cardiovascular disease in young people, like what messages do you think young people should know? Then I saw the slide that had, I think it was something, a statistic of like 40 to 48% of African Americans over 20. Did I see that correctly? You said over 20 years old have some form of cardiovascular disease?
Yes, over 20.
Oh my gosh. So that really alarmed me. So I wanted to ask you, like, what do you think is happening in terms of like young people? Like, what do you think young people, college age students, or even starting in high school need to know about this particular topic or this disease?
I think it's really important to visit a doctor regularly and just to stay up to date with how your body's doing and what your body needs. I think that's really important to know what's going into your body as well. I think there's a lot of things out there that people don't really know about and are harming them. So I think that's a main thing that younger people need to realize. But yeah, that's what I would say for sure.
Wow.
Taylor, I take it that you're also kind of an aspiring health field professional of some sort. And one of the things that, maybe I'll just open this up to both you and Micaela, but one of the things that I was thinking about was, you are young people. And as Micaela was talking about really preparing herself to work in all kinds of communities, I guess I'm wondering, from the vantage point that you're at as young people who are entering this field, what can you imagine would be some effective strategies for reaching African American communities with these messages, right? So now you have research, you have done some work to find out what is already being done. Can you see some opportunities that perhaps aren't being utilized just yet that look promising?
Yeah, so after graduation, I am actually attending Slippery Rock for physical therapy. So working as a physical therapist, you definitely see a lot of diverse people and a lot of diverse populations. So working with these people, I think, will definitely open many doors to different areas where I could work with. So hoping whenever I get that opportunity to work with patients, it will be beneficial for me to see their side and see the things that they go through and just being a help whenever I'm needed.
Mm-hmm. Mm-hmm. What about you, Micaela? Anything that you see as an opportunity for how to reach these communities to create greater awareness about these issues?
I definitely agree with what Taylor said, like being able to work wherever they put you. Say you can never know where you're going to work in the future. It's just wherever your path's going to take you, and being prepared, definitely, and just having the knowledge early on to be able to spread to different just people and everywhere in general will definitely be beneficial. And just everyone like educating people, and I think educating people through just conversations and when they're in the office for their appointments, making sure everyone knows about these issues such as sickle cell disease and, as Taylor said, cardiovascular disease, that they know these are issues within the communities and that they're just aware of it.
Mm.
I'm certainly thinking about some of the work that's being done in the medical humanities, which is about being more effective storytellers, so that when you do have the opportunity to speak to people or to engage communities, that you're telling the story about why they should be concerned in ways that are engaging to them, or that you're listening to their stories in ways that allow you to connect with them and build the connection that will get them on the path to wanting to be more attentive to their health. And so I think both of you are definitely on the right track in terms of, being able to communicate, which was something I think is kind of a theme here. But I encourage you to continue to think about, like, how do you take the research and the knowledge that you have and become so adept at using it that it becomes something that you can bring people into? What is the story that you tell that's going to get grandpa to go to see the cardiologist, as opposed to just being like, yeah, I'm fine, don't worry about it, I'll just push on through? Or, to take the grandbabies to the doctor when they're going to have to make a sacrifice somewhere else to get that baby to the doctor, but maybe we're going to find out that she has some kind of anemia that needs to be treated. So I guess I'm just wondering, like, how do we become more adept at engaging communities that very often feel underserved and underseen within the health fields, to make sure that they are being proactive about their own health.
One of the things that I think each of you can think about is, am I available to provide those services? You know, you have the knowledge, and so now do you encourage coworkers or your organization to go into the community? Because I think that you have to go where people are, and the medical field hasn't always been seen as a place to go for people of color. So can you go where they feel safe? Can you go to the church and do these things? Can you go to the barber shop? You know, so when I saw that, I think about how many volunteers would be required to do services in the community. And I mean, that's something in addition to what we do professionally, but I thought that was a great idea to meet people where they are. It's just like COVID. Some people are not going to take the COVID because they have all of these issues around it. But if you bring it in a community or in a church or whatever, people tend to do a little better. But I thought the presentations were great, ladies.
Thank you.
Yeah, thank you for that comment, because I tell you, in my mind, I was starting to think about trust, and I was going to ask you all, like, are you doing anything to like prepare yourself to start that idea of building trust within communities that you think you might be serving? Because I think that's like a skill to develop. And so like, in what ways are you starting maybe to think about that?
I definitely, the piece in the video where they did go to the barbershop, I think really opened my eyes for sure. Because when you're in an environment that is not so strict, maybe, that I don't know if that's the right word actually, but it seems less tense and more on a personal level. So I think going places like the park, even outside or somewhere like that, is definitely a place to earn trust and just make conversations and make relationships with people. And then after that, you can relate it back to maybe a hospital or maybe a care center where they can do more treatment.
Yeah, Taylor, I think you said it, like the relationships, right? And so how can we work to kind of start kind of developing relationships? One of the things I've been doing over my sabbatical is participating in a group. It's an urban soul line dancing group. So I've been going once a week, like religiously. And so like, it's a group of ladies. I mean, most of us are Black and over 50, okay? And we are in there dancing away. And I would say about every 3 weeks, we have a group of there's like nurses that come in and they check your BMI, your blood pressure, and do screenings and things like that. But I mean, it's great because it's in a local community center. And we're there, we're dancing, we're having fun, and which I know dance is a part of your background, right? And so it's a great place to be, because not only are we dancing because we love to dance and it's fun, but it's also about our health, right? And it's also about us kind of building relationships, being health conscious, you know, thinking about that as we're doing something that we enjoy doing, you know, and celebrating with each other. So I think those are things that are important. And I think my last question for the both of you is, what do you think colleges and universities need to do to address this more in student populations on campus?
Yeah, I think that's definitely a hard one. I think it's important to spread awareness. It's important to utilize social media, because it's basically all we use right now, especially going virtual. So I think the more you spread the word on social media and maybe through conferences like this, I think that's a great way to spread awareness for sure.
I also think like on college campuses, when we get an email every day of announcements, that there could always be something put in there, such as like just about our health, or especially right now with everything going on with COVID, just adding additional things about our health and staying healthy would be good.
It's such, I mean, thank you so much, Professor Payne, for asking that question, because it's really connecting for me that so many of these health issues that the two of you have researched and are identifying and coming across in your studies are things that in African American communities especially often start very early, right? It's not an onset of 40 or 50 years old as it might be in a dominant white culture. And so in college, you potentially have the opportunity to begin to build some practices, some ways of thinking among young people that can carry over into later adulthood, and maybe some awarenesses that they then can take back to their communities. So they become kind of ambassadors. Like if there are enough little health clinics that talk about things that impact special populations that they need to be aware of, and you're doing that outreach, when I go back home over Christmas, maybe I'm starting to talk to my family about, hey, did you know we had this thing at school that was kind of interesting? And, you know, and now all of a sudden Granny is like, maybe I need to get screened for that cancer thing. I didn't ever think about it, but, you know, so I guess I'm just wondering if there's like this opportunity to, while you're in college, to kind of build some ways of thinking among your peers that then can begin to grow much earlier than we typically get them. Because if anybody's like me, and you know, like I think I'm a pretty average Black woman, yeah, I didn't start paying attention until 40 when stuff started happening. And then all of a sudden it was like, wait a minute, I didn't even know these things were issues. And now all of a sudden I got a whole host of them I gotta manage. So
one of the things I think that happens in college, and I mean, eons ago when I was there, Temple University used to have in the spring, all of the different disciplines used to come out on our mall. So if you were in health, we would have health screening. We would have all these different Greek, I mean, it was everybody who was in an organization. So, you know, if you had the diversity commission, they were there giving out things. And I think that we really don't have enough of those kind of activities where students can learn about, or students can practice what they know. So for you to be able to have a table and have that out, because you want to be a physical therapist, or to talk about what a physical therapist does, we don't do enough of those kinds of things where people could then know that that's a central part of health.
Are either of you thinking about graduate school?
Yeah.
Both of you, okay. And
Taylor is coming up Slippery Rock, right?
that's right, you just said that, you sure did.
You have to look me up, please.
I will.
Okay.
Yeah, so I'm even thinking that as you're going into graduate studies, and you know, your focus is a very practical oriented profession, you know, so it's a professional degree, but are there opportunities to continue research that would allow you to continue this training in the areas that you will be able to better connect with communities and share knowledge with them and build relationships and improve health in those communities? So the research is so important, even though you're going to be practitioners. It feels to me like there's a real opportunity there as you move forward to keep that research edge that allows you to connect and be of service in those communities.
Well, I often teach this short story called The Telltale Heart. And so what I do is I allow my students that are like not in the English field to do reports that pertain to matters of the heart. So I think that sometimes it becomes the job of the instructors to find ways to put these items within our class and allow people to write in their discipline while still maintaining the requirements for the class. So great job with the presentations.
Thank you.
Okay, so excellent job, everybody. Let's give a round of applause to Taylor and Micaela. And there's some more information there in the chat, just a reference. And one is for the conference evaluation. So even though you were presenters, I think it's important for you to fill out the conference evaluation.
There's a
And
section for presenters.
say that again.
There's a section in there for presenters. So yes.
Yes.
Please do.
Okay, good. Yeah, so it's always great to get feedback because that's how we continue to grow and just to improve the process, and we know like what's working and what's not working, and so please take the time to fill out the conference eval. And then also, I believe this, the session 2, what I have in the chat is, I think that is the document of certification that you were here. Okay.
Where's it? Oh,
yes. So I have the link in the chat for that. So all you have to do is click on it, and then that will give you a document that says that you were present at this session. Okay.
okay.
All right. So don't forget to join us tonight at 6 p.m. for the special event. And then also tomorrow we'll start again at noon with session 3, which is racial disparities in career fields.
Oh, okay.
Speech, language, pathology, and special education. So that will be at noon. Okay, thank you. Thank you, everybody.
Yeah.
Thank you again.